Good afternoon, everyone. Good afternoon, Minnesota. Thank you, everyone, for taking time out of your Memorial Day weekend. I know Memorial Day is a time to reflect on those we've lost, especially associated with those who are willing to give the ultimate sacrifice for our freedoms. Those freedoms we hold so dear. They also come with responsibility they've given us. And I also know that a time of reflection around Memorial Day, a time of decorating the graves of our lost ones, and during the pandemic, that faith is a critical component of this. We've said from the beginning, trying to balance physical, mental, economic, and spiritual well-being of Minnesotans is something that goes into every decision that we make. I'd also like to note that it's not just Memorial Day. Our Muslim neighbors and Minnesotans are celebrating Eid, the breaking of the fast. I'd like to give a special thank you to the imams and to the mosques across Minnesota who have gone out of your way to keep your people safe during the 30 days of the fast during Ramadan. Very, very difficult to do because the joyousness, and we had the opportunity to share an iftar dinner at my residence last year. But that devotion and a lot of it about the generosity, compassion, and charity that goes with this last month and what goes into today. So I wish you a blessed Eid Mubarak to you, your family, your children, and to the entire community. I'd also like to note that oftentimes the issue, especially in a secular society, people do not expect their elected officials or their governor to give them a sermon, but I do think there's an expectation you try and live one. And I don't talk a lot about this, but I think for all of us, there's this important part of our life too, and I want to acknowledge the difficulty around gathering in congregations, in parishes, at a time when COVID-19, one of our things we worry about most, is large, unpredictable settings where people are speaking or singing for long periods of time, and the chance of infection rates. And so with that being the case, this last week has been a little bit all over the place for a lot of people. CDC guidance came out on Tuesday instructing about places of worship and how to deal with large gatherings. On Wednesday, we turned our dial a little more in Minnesota. We turned that dial against a backdrop of increasing cases, increasing deaths, and what I think has been very clear since some of our earliest modeling and since Commissioner Malcolm's addressed this, that Minnesotans would be climbing the peak in summer. And that we are still on the way up. We are not at that peak yet. With that being said, I have spent the last weeks and certainly the last few days in consultation with spiritual leaders, certainly with Archbishop Hebda and Reverend Woodford from the Missouri Synod of Lutheran Church, but countless others. We have been on Zoom calls, we have called conference calls, and over the last year and a half spent a lot of time with the interfaith groups and thinking. And I want to highlight too, many of these folks have worked with us, and Archbishop Hebda was a staunch ally, especially around the issues of homelessness this winter and food security. And those relationships matter. They matter especially now. I spent a lot of time on Thursday evening with the White House and spoke extensively to Vice President Pence, who proactively reached out and called, telling us that CDC would be issuing new guidance on Friday, and they did. And so in consultation with all of the groups, in consultation with the Department of Health and the best guidance in using CDC guidance, Lieutenant Governor Flanagan and I are talking about a partnership with our Minnesota faith leaders, making sure that as we move to try and have some of these places of worship open up, they're done with a common goal of the safety and security of not only the congregants, but of the community at large. And so starting on May 27th, places of worship may open at a 25% occupancy if they adhere to social distancing and other public health guidelines to keep congregants safe. And I want to say that many of these congregations have gone to great length to think about this. I would also like to say many have made a choice and will continue to make the choice to not open for large gatherings and to continue, like my parish, Pilgrim Lutheran, to continue to do things virtually, which we have been doing now for some weeks. We're going to continue to encourage Minnesotans to stay home, urge faith communities to hold remote services as much as possible. And there is no requirement, obviously, to open. These are choices that need to be made. But now that we have CDC guidance, now that we have health guidance, this is a way for us to partner together in an agreement with the Archbishop, especially around that congregation and around the Catholic faith, but extending to others. And I want to be clear, this is a floor, not a ceiling. The expectations are that the more, and every time we make a move, we understand that there's an inherent risk of spreading COVID-19. And again, this comes against a backdrop of some of our, especially metro hospitals, reaching pretty much normal capacity on ICU units and now starting to build out that surge capacity into the 24-hour and 72-hour surge. Again, I would be clear to Minnesotans, the worst is not yet past in terms of infections and infection rates, and we're learning more every day. And I know Commissioner Malcolm's going to talk about our ability to reach out today on 6 remote sites to do massive testing with no barriers for Minnesotans. And once we announced those, lines were lined up hours ahead of time to try and get those tests. So Minnesotans have made great sacrifices to protect their neighbors by staying home. Each step we make brings a new normal that we're trying to get to, that we can maintain this, as we've always said, to preserve hospital capacity, to protect frontline healthcare workers, to protect the personal protective equipment that they have, and striking a balance with Minnesotans' freedoms to exercise their religion, their economic activities, or the things that they choose to do. But public health requirements throughout time have required us collaborate together, that we are our brother's keeper in this case, to making sure that what we do is going to have an impact on greater Minnesota. It's going to have an impact on the spread or the slowing of it by those basic principles of staying home when you're sick, washing your hands, wear a mask, keep travel to the bare minimums. None of those things have changed. So I encourage Minnesotans to continue to do the right thing, limit your in-person interactions outside your household, continue to wear the mask. I'd like to thank Mayor Fry of Minneapolis. I think made a proactive move around making sure that that community where we have a higher concentration is wearing masks. It makes good sense. I strongly urge folks to continue to understand we're in a heightened state of alert because of the climb where we're at. And I'd just like to say, those who disregard public health guidance aren't just making a statement about their personal freedom. They're endangering their family and their neighbors. And that is why we have always had an agreement around societal things where your personal freedoms don't infringe on someone else's personal freedoms or safety. And we are trying to strike that proper balance. So our strength lies in our unity. I understand that. I understand how incredibly hard this is, whether we are talking about the economic pain that COVID-19 has put on us, whether we're talking about the physical health and the loss of loved one that COVID-19 has put on us, or what COVID-19 has done to reduce the things that I continue to say are the most joyous, the large events where we gather with our fellow human beings, in this case to celebrate our spiritual side of things, to celebrate our sense of community, or whether it's gathering for a baseball game when summer's on, of some of the things that make life as joyous as it is. But we've got work to do. This is not over. We have no vaccine. We still have no clear-cut therapeutics, and our numbers in Minnesota will continue to go. We've done a good job, but again, the flattening the curve was going to be very, very difficult. We knew that what we could do is push the curve out and prepare for it. But again, our analogy of that pot is simmering, and one notch too high gets it boiling. And I think all of us want to see our businesses, our places of worship, eventually our schools, when they open, be able to maintain and stay open. So I ask all of you to continue to work with us. I want to thank the faith community for partnering with us on this. I want to thank them for taking guidance that was relatively vague from the CDC and create something that I think has the potential to both keep us safe, but allow people the religious freedoms that they need. And with that, I think I will let Commissioner Malcolm update us on the current situation, then we'll be ready for some questions.
Thank you, Governor. Good afternoon, everyone. Well, these are complicated times. These are mixed times when we feel good about making some progress toward reopening our society, but against the backdrop of a great deal of caution. I just want to share with you the Minnesota data for today. We are reporting an additional 847 new laboratory confirmed cases. So this is the highest daily total following another 800-day increase the prior day. So we are now at 19,845 laboratory confirmed cases. That increase of 847 came on top of quite a good, robust testing day yesterday, 8,522. Not quite our top day, but one of the highest volume testing days that we have seen. As the governor mentioned, the 6 armory sites around the state are very, very busy today. We are glad to see that. I have been saying in recent days that we wanted to encourage Minnesotans to come out and get tested, that we were concerned that people weren't aware of the fact that testing is more available now, and I'm just, I know that people are waiting in lines, and there's an awful lot of demand there, and we're learning a lot from today's events that will help us to be even better at getting testing out into the community where people are. So thank you so much for taking advantage of this opportunity, Minnesotans. In addition to the largest daily increase we've had in cases today, we did have an additional 10 deaths, bringing our total to 852. And there are 568 people in the hospital today, 215 of them in ICUs. On yesterday's call, I mentioned that I wasn't sure whether any of the hospitals had yet gone into their surge capacity with their ICU beds, and in fact they have. I think both of our level 1 trauma centers have had to activate additional beds, which is really important because we need those level 1 trauma centers obviously to be able to fulfill their entire missions and not only be full with COVID cases. So we have to take this very seriously. The rapid case increases, some of it, but not all of it, fueled by the increased testing that we're seeing. We're going to keep our eyes sharply on that test positivity rate. But as I think the governor and I have both said, this comes against the backdrop of knowing that we've got some of the largest, most rapid increases in some of our counties in the country. So while we appreciate and support Minnesotans' desire to want to resume some of their most important health practices, and we at the health department certainly know that health is more than just the absence of physical disease. It's all about well-being, and we know how important faith is to the well-being of Minnesotans. And as the governor said, when the president made his announcement and the CDC came out with guidance, it was really very, very general, leaving to the states and locals the job of coming up with more specific guidance, which we have been working to do. And as the governor said, he and we have been in discussion with faith leaders for a long time and will continue to do that. As the governor said, and I just really want to reinforce this message, large gatherings continue to present a clear, documented risk for increasing the spread of COVID-19. And as I've just said, we continue to see pretty rapid increases in our numbers of cases and deaths. So even though we are slowly and carefully trying to open up opportunities for Minnesotans to resume activities that are so important, this does not mean we're on the other side of this. We are not in a position of being able to drop all of those precautions. This is not a return to normal. We encourage and recommend, as the governor said, that places of worship continue to do what they've been doing, to offer virtual or remote services and maintain some of the important changes that they've made so far, rather than immediately bringing many people back together in person as the best way of protecting their faith community and the larger community. Each faith community will need to consider all of these factors. We know and respect that they will be very mindful of the impact of these decisions. But if places of worship do decide to offer in-person services, we want to help them follow appropriate practices to protect Minnesotans. So we've put a significantly detailed new guidance out just this afternoon. It literally is being completed as we speak. And as the governor already hit the highlights of his new executive order, which is backed up by this very detailed health department guidance. And under the governor's executive order, places of worship, funeral homes, and other venues that offer spaces for ceremonies, weddings, funerals, and planned services such as worship, rituals, prayer meetings, scripture studies may host such services with more than 10 people, which had been our prior guidance, provided that they also adhere to the following requirements. Among these requirements are that in all settings, physical distance of at least 6 feet must be maintained between households, both in front and to the sides. In indoor settings, occupancy must not exceed 25% of the normal occupancy capacity as determined by the fire marshal, with an absolute maximum of 250 people in a single self-contained space. So it's the lower of those two numbers, 25% capacity or 250 people. In an outdoor settings, gatherings must not exceed 250 individuals. These venues and places of worship must also develop and implement a COVID-19 preparedness plan in accordance with all of the guidance developed by state agencies. Those guidances include detailed protections and protocols for staff, cleaning practices, social distancing guidelines, and more. These plans need to be posted in locations that can be easily accessible by leadership of the venues, staff, volunteers, and the public. For Minnesotans attending these services, it's so important for them to follow these guidelines and maintain social distancing. And please, as always, stay home if you're sick and practice those good personal behaviors. I also just want to make a point that I'm sure is quite clear to most people, that people who are older and have underlying medical conditions are still at higher risk for severe illness and should consider avoiding these gatherings where they may be exposed. I know how difficult that can be. I know that these are some of the folks most eager to reconnect with their faith communities, but minimizing exposures is one of the best things we can do to keep ourselves, our loved ones, and our communities safe. And as the governor just said, being able to keep moving forward, to keep incrementally opening more opportunities for people to be together is going to depend on our collective ability to take these measures and really hold these new behaviors as our new normal so that we can keep moving together forward. Thank you very much.
Thank you, Commissioner, and I'd like to note that the guidance that we use from CDC, the ability to work on this was done in partnership with our faith communities. We are grateful for them. I think they are going to be stressing these very same things because, again, I think we know we share that commonality of the desire to get people back cannot override the ability to keep the community safe and those most vulnerable safe. And I'd also just like to acknowledge the fact on this. It takes about 5 seconds when people do this, and there's an entire cottage industry in this of finding contradictions of trying to balance everything that we're trying to balance. There's 50 different states doing this. Last week we had 2 different massive guidances, one on Tuesday and one on Friday, dealing with houses of worship, and then we clearly had the president expressing a strong desire to do this. And when that's done across all 50 states, all of us are in different positions in the pandemic curve, in the epidemiological curve. So it makes it difficult as you're trying to put them together. It does, though, come back to that basic fact. My first responsibility, first and foremost, is the safety and security of Minnesotans. And I talked about how to try to balance it in the safety, security, including economics, including mental health, including spiritual health, but at the end of the day, seeing how it impacts broader community. And I hope everyone, in the way we're trying to look at this, the things we're putting in place need to get us through until we get a vaccine. And I think most of us and most in the scientific community believe we are going to see subsequent waves of COVID-19. We are going to see changes that go forward. And to be able to protect against that, we have to, again, going back to some of the very first times I spoke to you Minnesotans, that I understood you can't lock everything down indefinitely, and you have to find what's sustainable and keep it just below that level where you overrun the healthcare systems and put more people at risk. So this is a step to find that. I am again grateful for the partnership of the faith community to help us work on this. I will again reiterate everything that Jan said, and along with that desire to protect our neighbors as well as understanding your freedoms. On Memorial Day, we were given a lot of freedoms by those who sacrificed, but we also have a lot of responsibilities to one another to make that happen. So at this time, I'd be glad to take any questions. So here.
Governor, if your order allows for outdoor weddings up to 250 people, does that now open up a dialogue about potentially allowing, say, graduation ceremonies outdoors?
Yeah, it may, and we've taken the fact on this. We saw a graduation ceremony last week kind of go outside the rules we had, and of course we had somebody positive, and now we are contract tracing that entire group. At this time, we're not making any changes on that. Again, as I said, the apparent contradictions you get in anything you do on this are very difficult. And we knew this last week when we were making the decisions of where we were at on graduations. But at this point in time, many of those decisions have been made. We're asking people to continue to do with the guidance that was put out by MDE. And there has been no guidance changing those type of gatherings from CDC. CDC was very specific around religious events.
Governor, had you been considering making this change even before the churches came out Wednesday evening and said, we're going to go ahead and hold services anyway?
Yeah, it was, every time we have one of these, it's a great question. We have multiple courses of action, and it's in a matrix of option 1, option 2, option 3, option 4, option 5, and then we kind of move those around. Again, based on the best guidance, I oftentimes, in the conversations we're having, we're on Zoom, and I will ask the commissioner to weigh in, and I said, where's your comfort level now? And we do it on a 1 to 10, that I have no comfort in this at all. And so we were talking about that, and I think just candidly, we all understood what happened when the president decided to talk about this. The churches were already making these decisions, and from a value statement perspective, I'm in absolute agreement that the pain that's being caused by not being able to do some of the things they do is real. And again, the Archbishop, Reverend Woodford, many others have stressed clearly their desire to not put their parishioners at risk, and their guidance, and even inside the Archdiocese, they're not all acting the same way. But yes, that discussion was out there. I think every one of the scenarios you can possibly imagine, we run through and weigh off one another. And the problem with it is when you put it into that matrix, the contradictions start to show up. The first question today was obviously one of the most obvious, and I think we'll have a follow-up probably on restaurants and bars. That's how this all goes in there. All around, my ideas are focused on trying to gather the best data we can, strike that proper balance, and keep this number down. I get most concerned when people start making the decision based on, well, this isn't that bad, it's just the flu, it's not going to get there. None of those things are true. And I don't have the luxury of picking one side of that. I want to get this open, let's get it open, without having to see the other side of it. So we had been thinking about it. This and graduations have been deeply difficult. I think mainly because the economic pain that's out there, we feel that with the restaurateurs, but you can basically replicate a dinner out. You don't get another shot at the wedding you had planned. Certainly you don't get another shot at the graduation in the same way, and that's why. And then again, of course, I think the case that the president is making, and that may be up for debate in this country, of deeming houses of worship essential services. And that's one that we take into consideration. So Dana?
For Minnesotans who are now looking at planning a wedding or a funeral, what is the line for any sort of banquet or gathering after they have that ceremony?
This is a good question. I'll have Jan mention this. I would just say this doesn't extend to the reception, the food, the extensive time. But again, the million steps that happen in this outside of what seems logical is all based on what is the risk of increased virus transmission in that environment. So Jan, maybe you want to take that.
Thank you, Governor. You got the essence of it, and thanks for the question. It's important to clarify that we're talking about the ceremonies themselves and not the celebrations that typically accompany those ceremonies. That within these venues, whether they be houses of worship or other venues that are hosting the ceremonies, there is no communal sharing of food other than what's specific to the ceremony itself, and even there we're strongly encouraging no direct personal contact. But with respect to the celebrations, the parties afterwards, those are still subject to the outdoor gathering limits and the same size requirements that we've been talking about for outdoor venues like restaurants and bars.
To the specifics of some of these religious ceremonies, communion, singing, are there restrictions in place as folks go back?
I think what you'll see in the detailed guidance is exactly that. It is quite specific, quite detailed. It is guidance. It is strong recommendations for everyone to wear masks, for example. And with respect to singing, strong recommendations that there not be congregate singing. That if there is a singer, we strongly encourage the use of recorded music only. If there is a singer, we recommend it be a single singer, separated by quite a distance from other people, wearing a mask or behind some sort of a shield.
Yes.
Yeah, Governor, the follow-up on restaurants and bars. Restaurants have said they were blindsided by the decision this week to only allow for outdoor dining. Does that reaction surprise you, and are you rethinking in any way the guidelines for restaurants?
Well, it surprises me a little bit. I think we all have expectations, and I think the expectations were relatively high by bars and restaurants, and I understand that. They are probably the most fragile in the economy. They are probably the hardest hit, and they are probably in the most difficult economic shape of coming back. What I've told them is that we wanted to work with them. We moved as quickly as we could on curbside. We moved on alcohol sales outside. We moved on getting it outside, but we're still relatively uncomfortable with where we're at on that. We know that these are ongoing situations. I mean, a week is like a year now. We'll certainly continue to have communication with them. I don't think it should have been totally out of the realm that we were concerned if they were also simultaneously watching what we were saying about the curve going up. It seems like so many times, and I see this, folks go and say, I want to open up the restaurant, I support these people to open up. If you don't have to take the other side of the ledger, that's an easy one to argue. The problem we've got right now is that we are peaking on this. And I think the timing is difficult. The timing for Minnesotans is difficult. If you watch Governor Cuomo or you watch some of the other places, I saw Dr. Birx. Dr. Birx called out Minnesota as being one of the places that is in the climb of where we're going, just the nature of where we pushed back, where we were at. So I'll continue that conversation. We want to continue to move as much as possible. I understand, and I'm not going to insult the restaurateurs by telling them that this is painful for them. They know that. They don't need to hear that. My take is to try and always move some of these things. Now, obviously for us, the situation changed too when CDC made changes to the requirements around houses of worship. They have not changed those requirements around bars and restaurants at this time. And again, the president was very clear early on in this that each governor had to have the responsibility to understand what their particular state situation was and adjust accordingly. And at this point in time, I am still convinced we have more work to do around that, but that conversation will continue to happen. Yes.
I have a question here from Christopher Snowbank at the Star Tribune. He asks, a CDC case study this week about COVID-19 illnesses at a church in Arkansas suggests a high risk of illness and death for churchgoers 65 and older. And Chris asks, should churches consider separate services for older members and those with underlying medical problems? Is there any other strategies that Minnesota is?
I'll let Jan give the health advice on that. I will give from where I'm at. First of all, we've all read that extensively. We spent a lot of time on this one plus the other ones. We know of the situation in Annandale here in Minnesota that are coming up. I want to reiterate again. My guidance to folks is, if you can, and it's in the situation, continue to remote worship where you can. Continue to find the new ways. I am under no illusion whatsoever. Every move we make that loosens up increases the risk. And the job I have to figure out, along with the folks advising me and the people doing it, and in this case, the faith leaders, of how do we minimize that as much as possible. I certainly would strongly encourage anyone over the age of 65 to give deep consideration to if they are going to do this. All measures can be put in place, but as we've seen, that's not always good enough. So yeah, we're very familiar with that, and I don't think, and again, this is just simply the math and the science behind this. You have more gatherings of more people, you're going to have more COVID outbreak. And when you're in a place where, as the commissioner said, we are still, again, we'll see more, still at that 10% rate, which is the guidance that we're kind of looking for in terms of positive rates amongst testing. I think today's mission that I asked them to do, to go out and people come on their own to come in, will be a really good indicator. We're not naive on this. We don't believe you should be out asymptomatic or, asymptomatically testing everyone across the state or thinking that that was going to happen. But we wanted to do a little bit of surveillance here. We also wanted to change the attitude about folks, make it a little easier. Remember, these things we're doing today are totally barrier-free. There's no cost, there's no wait, there's no sign-up, you'll get your results. I think that's going to, all those types of things will give us a better idea where we're at. But yeah, it's a good question.
Can you tell us a little bit about how the decisions around faith communities were different? What factors in terms of health are different sitting for a worship service as compared to visiting a business or a salon?
It's a good question.
Well, as I mentioned in today's comments, we're really very mindful that worship is special, plays a special role in health and well-being, particularly in these very stressful times. I think the faith leaders have made quite a compelling case for the fact that that worship is something that is badly needed right now when people are feeling in such stress and so many mental health concerns, isolation. Isolation is itself a threat to health. We know that. So I think we do differentiate that aspect of houses of worship as different from other gathering places. There's a positive health benefit to that spiritual support. We're clearly aware of that. And then I just think that the thought that's going into the predictability of the settings, we've talked before, what the three big risks are is proximity, length of proximity, and predictability of the setting. And I think in a prior conversation we talked about the fact that leaders of these faith communities know their community. They tend to know their regular gatherings and can counsel folks who maybe shouldn't come to the service. And what happens in the service is literally scripted, unlike some of these other celebrations that are more spontaneous, and we would just expect more less adherence to kind of the norms of the rituals. So those are a few of the considerations that, while I think the governor and I both tried to be really clear about the fact that we really urge caution here, and we know that not all places of worship are going to open up. Some have already made that decision. We support that. We encourage really, really careful consideration. We encourage all houses of worship to continue doing creative things like virtual services. But when they do decide to open up, if they do decide to open up, doing so within these really very specific health guidelines, we hope will help to protect the health of the people celebrating, as well as the larger community.
Dana, if I could, I want to just address this. It's what's difficult about this, the one-size-fits-all conundrum of saying, well, how different it is in Roseau as compared to Minneapolis, just geographically, but in so many of these. And I guess, to be candid, the 250 number terrifies me. I think, I don't want to speak for the commissioner, but I'm worried about that. But I want to say how we came to some of this, and I want to give the faith community leaders we've been working on this for weeks, have been incredibly thoughtful. They have been incredibly respectful and generous about how did we work to get this, because we did have the same goals. And when we talked about this, they've really thought this through. I think we all know there are small country churches that seat about 50, and there are large mega churches that can seat 4,000. And as we looked at this and talked about it, trying to not get those contradictions that are almost inevitable, but saying, we have three different levels separated by entrance points that can easily accommodate, and our 25% capacity could be 1,200 if we did that. But then coming to the idea and saying, we're not asking for 1,200. We're asking the ability to do this. So that faith part of it, and again, I got this, and the fallback position was, and it was just frustrating for me because it's very hard to answer that. All right, not the Cathedral of St. Paul, but the Candy Barn can be open. Explain that to us. That's the things that are maddening about this, because it's very hard to do, but it has to do with those interactions. It has to do with the length of time there and the type of activity. But I certainly want to acknowledge to Minnesotans who find the contradictions maddening, so do I. And again, I certainly wish COVID-19 didn't do this, and I wish there was more that we knew we're learning all along, but that's how we came to that.
Just to follow up.
Sorry.
Just to follow up again on the restaurants, do you think, are you anticipating that things could change prior to June 1st?
I would not say that, but I think it's in all fairness. I don't want to set the unrealistic expectations, but I do want to hear them and say them. I understand their great frustrations. I totally get it. And if I'm them right now, I'm looking into what happened here and saying, well, you know, the Archbishop spoke up. I would also say the President spoke up and CDC spoke up, and we'd been working on it. We're hearing them on this. I mean, it is in everyone's best interest that we strike the proper balance between public health and the economic growth. And so I certainly don't want to say that we're not talking every day. And again, this is one of the challenges. And I will always own this from the perspective of being the governor of Minnesota, of doing the best I can to make sure people don't feel blindsided by this. If they're telling me that they felt blindsided by that, then that's real. That's how they're feeling. And I have to figure out a better way to make sure I'm conveying with them. I don't want to give false hope on this, but I also don't want to close the door as we try and talk through this, because what I need, I think all of us saw this, and I've been talking about it from the very beginning. The vast majority of people are not doing these things because there's an executive order. They're doing it because they believe the science and believe it's a path forward to get this right. If we get to a point where people choose to not believe it's the best way forward, you lose the capacity to do it, and we'll get virus spread. So I want to make sure that those are folks that don't feel like they're put in an absolutely untenable situation, and they're continuing to work with us. Yes, sorry.
To follow on that, I have a text from Chris Warafsky at KARE 11. He says he's spoken with the Blue Plate Restaurant Company. They own 10 restaurants in the Twin Cities. They say they have a month left before they have to close. Is there a compromise you could reach with restaurant owners, or would you compromise with restaurant owners like you did with faith leaders?
I would always compromise when we can, when the science gets us to that point, when the guidance that's coming down gets to that point. I'm trying as hard as I can. I think the myth around this is that there's any joy whatsoever of keeping someplace open. The thing that frustrates me is when I see elected leaders stand in front of places celebrating and demand they be open. They're not with me when I have to go open the new morgue. They're not with me when I have to see the rates that are going. They're not with me when I ask them to help us get money to places. What I'm saying is I'm trying the best I can to work with them in this. I hear them. I think a month is probably, in many cases, more than most of these folks have. So we are trying the best we can. I can't change the trajectory of where COVID-19 goes unless I get the collaboration and cooperation of folks to bring it back down. Because again, I have to say, especially in the Twin Cities, and this is where we started talking regionally, maybe start thinking this way, and I'm more than willing to continue to have that conversation, but I think it's going to be very difficult over the next couple weeks, and I don't say this to alarm people. I think it's been my responsibility to be as candid and open and as honest as possible. It is my belief we are going to see some pretty rough weeks as we head to that peak, no matter what we do. And if things change more so, I find it pretty difficult to see we'd be able to do that. But I'm more than willing to continue. And it's not so much a compromise and a deal and you're trading on a car or something like that. You're adding your points of view in and trying to match up where does the science meet. In this case, I think we've been able to do that with the faith community, but I have to be candid with you. They're going to have to follow these guidelines really, really closely. There's going to have to be a strong desire of the parishioners to follow along almost to the letter, or we will start to do that. Those conversations we're having with the restaurants right now too.
On the conversations you're having with restaurant owners, what are some of the things they're proposing to you, and why might they not work right now?
Yeah, well, and Jan, you may want to speak to this. Some of it has to do, again, with that, how long you're in a place, your mask is going to be off, you're going to be sitting there for an extended period of time. That goes back to those three things: how close you are to someone, how long you've spent with them, and the unpredictability is it. Who came in behind you? So we're talking about things of accepting reservations, that you have to have reservations. And the reason we're asking for that is not to infringe on anybody's personal liberties, but we have got to do contact tracing. Just to be clear, this massive moonshot of testing that's getting close to the 10,000 we wanted by the end of May is totally useless if we can't use it to do contract tracing and isolate this. And if we're going to maintain, and these restaurants are going to stay open for the next year, they're going to have to understand we are going to be putting out these fires, testing, contract tracing, and moving. And at this point in time, all of that is still heading up.
I'm up, okay. I had a question about the health plans and cost sharing. That agreement with the 6 health plans to waive cost sharing for COVID care expires at the end of the month. Are there any plans to extend that, or are you discussing that with the health plans?
Yeah.
Well, we really appreciate what the health plans have done and have been willing to continue to talk with us about that. And we do definitely need to kind of get back together and talk about where we are in the epidemic. I think when that agreement was, when they made that agreement, none of us knew with any precision what we'd be looking at in terms of length of time. So I'd love to talk to them about, along with Commissioner Kelly at Commerce, who we share the regulation of that sector. So yeah, that's an important conversation to renew. And I'd like to talk to them about their role in, how they can help to support some of the broader community efforts as well, which many of them are. They volunteered to help be part of this contact tracing surge that we're doing. Some have volunteered employees to be part of that effort. So I really can't say enough about the collaborative spirit of our Minnesota health community, but much more to come on the specifics of how we finance the testing regimen.
So as of now, if somebody is in the ICU in the hospital starting June 1st, they could be getting a bill?
Without clarification of whether that extends, that would be correct, but it'll be our intention to get clear about that just in the very next few days here.
Dana, and then we got it.
Okay. Question from Mary LaHammer. Public opinion polls are out in the field. Can you speak a little bit to how those influence your decision making, if at all?
Well, I certainly care what people think about, but not in the sense of, we're going to put our finger in the wind and move where things are at. These are tough decisions. I have no illusion whatsoever that people are pretty darn mad about having to do some of these things. My hope is that they understand why I'm doing it, they believe the science behind it, and they can start to see some results or believe the results are out there. So I don't think, we certainly don't dwell on them, but I do think it matters if people are telling us, if the question is we're not getting enough information. It doesn't appear like there's consistency in this. We think the regulations are too restrictive. Some of that then becomes a communication piece where if I have to be able to communicate why we're making these moves, and I'll be the first to tell you it becomes very difficult because it's easy. I mean, we've got smart people in this room and listening. Contradictions are a part of this, but that is just we've never seen a global pandemic, but we watch to listen. Again, certainly not to be influenced against the science and against what we feel is best. But I also know that it does take, as I've said, a social compact of people to buy in and believe that they're going to get this right. And I think that's what was proven. That's why I'm gratified and grateful for the faith community leaders on this as we all sat down and worked this out. We have a solid plan that, if followed, can keep people safe. It was a compromise, and we were able to do that by setting around common goals. So I think if that's what the public opinion polls are showing that they want to hear, we're watching that and listening.
I got one question. Can we go back to the businesses? If these businesses that can't open, these restaurants, what are you going to do if they do open?
Well, we certainly, as I said, we have to have public support. We have a case that's unfortunate when it does that. I think we'll get some clarity. The Attorney General's office is holding up this. I think there's a strong precedence across the country that emergency orders in the name of public health stand up. We're going to encourage them to get there. I think one of the things that I'm encouraging us to think about on this is we, as a nation, federal government and state government, ask people to stay home to protect their neighbors. In countries that are faring much better in this, the government did its job of backfilling. I would ask that the legislature in Minnesota help us finish the business grants that we want to get out. Help us finish the bonding bill to get out. Help us figure out, while cities are sitting and waiting to get their money from the federal government, let's do that. And I want to be clear, the only reason that didn't happen, for many reasons, is I was asked not to use my executive power. Just to be clear, the National Guard armories and the National Guard being activated to do that testing today is the executive power that I have. I exercised it yesterday to lift weight limits on trucks that are disposing of hogs. And so what I would say to those business owners is, we've asked you to stay home. Many other countries have done much more to provide them the economic support underneath, so they're not forced to make a choice where they have to go back. And I think most people recognize this. Lifting the ban in its entirety on restaurants, like you saw in many cases in Georgia, brought about 15% of the business back. That's about it. And in terms of unemployment across the nation, we have the second lowest of ridiculously high numbers. So this is shared across the nation. The one piece we're not getting into this isn't the government stopping people from doing businesses. This is us asking people under health orders to keep everyone safe so that we can get back to normal quicker. But I think the thing where if there is something that is failing, it's at the federal level in the stimulus coming out, and it's our ability here in Minnesota to move this, because those businesses are going to be much better supported if they had an infusion of cash like the PPP. But other countries, and I will make the argument, we can do better about targeting that. So again, if I'm going to ask folks to stay home, I can't send them home without money to buy food, groceries, and pay rent, and neither can the federal government. And that's the point I would like to make, that I think we could ease some of this tension if we would help more on the stimulus side of thing in an emergency. That's the way to get them back. So with that, I would like to thank you all. Again, my thanks to Minnesotans for continuing to look out for their neighbors. It is Memorial Day weekend. As I've always said, it's a time of reflection, and a lot of times every year I go somewhere else, or I end up at Fort Snelling. For my time as a member of Congress, I used to go down to the Vietnam Veterans Memorial down below my house in Mankato for many years. And I would sometimes hear people say, most Minnesotans and most Americans don't even know what Memorial Day is. It's a day to get the boat out. It's a day to have barbecues. It's a day to spend that. And my response to that always was, what an incredible gift that we were given. The incredible gift for our young people to be able to have a carefree weekend, to enjoy the gifts that free people can have. And so I would make the case on that is, that's not such a bad thing as long as we're able to pause for a little bit and reflect. And I would just like to close today. It's something that I personally believe one of the greatest speeches ever given in American history. And earlier this year, we missed an opportunity because of COVID-19 to stop and pause and memorialize the way I think it should have been. The 75th anniversary of the Battle of Iwo Jima came in March. And as many of you are familiar with this, that small volcanic island in the Pacific was one of the touchstones for what was going to look like it would be the island hopping to the invasion of Japan. And as it turned out, it became one of the bloodiest and most ferocious battles in Marine Corps history. The seas ran red with blood. When the battle ended after a month and the bodies were being gathered, they were looking for a chaplain to do the eulogy over the dead. And the only one there was the Marine Corps' only rabbi in the chaplain corps. And because of America in 1945 and segregation, there was a lot of racism and discrimination, and it was decided that Rabbi Gittelshin would only give his eulogy over the Jewish dead who were there. And but he spoke to all who were there. So I want to just give you, and this is, again, much like the Gettysburg Address, very short. I'll give you just a quick abbreviated version of this, but I would ask all of you on this Memorial Day to think about the words on this, not just in the context of those who sacrificed at Iwo Jima, but what it means to be an American in 2020 in the middle of a pandemic, and what our responsibility are to our neighbors. Here before us lie the bodies of comrades and friends, men who until yesterday or last week laughed with us, joked with us, trained with us, men who fought with us and feared with us. Somewhere in this plot of ground, there may lie the man who could have discovered the cure for cancer. Under one of these Christian crosses or beneath a Jewish Star of David, there may now rest a man who was destined to be a great prophet, to find a way to perhaps for all to live in plenty, with poverty and hardship for none. Now they lie here silently in this sacred soil, and we gather to consecrate the earth in their memory. It's not easy to do. Some of us have buried our closest friends here. To speak in the memory of such men is not easy. No, our poor power of speech can add nothing to what these men have already done. All that we can even hope to do is follow their example, to show the same selfless courage in peace that they did in war, to swear that by the grace of God and the stubborn strength and power of the human will, their sons and ours will never suffer these pains again. These men have done their job well. They have paid a ghastly price for our freedoms. So today we dedicate ourselves first to live together in peace, the way they fought and are buried in this war. Here lie officers and enlisted men, black and white, rich and poor together. Here no man prefers another because of his faith or despises him because of his color. Here there are no quotas of how many from each group are admitted or allowed. Among these men there is no discrimination, no prejudice, no hatred. Theirs is the highest and purest democracy. And any of us, the living, who fails to understand this will thereby betray those who lie dead. Whoever else lifts his hand in hate against a brother or thinks himself superior to those who happen to be in the minority makes of this ceremony and their bloody sacrifice it commemorates an empty, hollow mockery. To this, then, is our solemn sacred duty. Do we, the living, now dedicate ourselves to the rights of Protestants, Catholic, and Jews, of white and black alike, to the democracy for all of which of them have paid a price. We do solemnly swear this shall not have been out of vain, should not have been in vain, and from the suffering and sorrow who mourn them, we promise the birth of new freedoms for the sons of men everywhere. And with that, Minnesota, this is our generation's challenge. We have the opportunity to reflect on what's come before us. We will get through COVID-19. We will do it together, and every single one of our neighbors, their rights to religious freedoms, their rights to economic freedoms and prosperities, their rights to physical health are things that we can all together make easier for all of us. So with that, I wish you a peaceful Memorial Day.